My name is Susan Voss, and I'm the Iowa Insurance Commissioner. I've been commissioner for 8 years, but I've also been in the insurance division for almost 20. And in the entire time that I've been a regulator, one of the hottest topics we've dealt with is healthcare. In fact, when I started in 1993, we were talking about healthcare under former President Bill Clinton. Do you remember we were talking about putting together some way to get people access to healthcare? And in Iowa, we were talking about ways to help folks who had pre-existing conditions or illnesses or issues within their medical history that barred them from getting coverage at affordable rates. We've set up a lot of different types of systems to assist Iowans to get coverage, but at the end of the day, we've continued to have challenges with costs and even challenges with getting a coverage that makes sense for people in various parts of the state. In 2010, the Affordable Care Act was passed, and I know you've read a lot about it, whether pro or con, but one of the issues that Angie and I are here to talk about is the exchanges and what's currently happening and how do we think that may benefit you on a number of levels. First of all, I want you to know that if you already have health care coverage, you are not going to lose your coverage just because the exchanges will be set up in Iowa. If you like what you have and you, for example, if you purchase coverage on your own, you're not going to be forced to drop your personal coverage and go into an exchange. But the exchanges under the law have been created to allow sort of for one-stop shopping. So people can go to one place and determine what coverage is best for them. For example, there may be people out in Iowa who actually would, based on their income and circumstances, would be eligible for Medicaid. This system will allow them to figure that out immediately and they could become Medicaid eligible. Or there may be other types of private insurance that you may be eligible for that you didn't realize, and you would also be eligible for some kind of tax subsidy or assistance. The exchange will automatically help you determine what that subsidy would be. In Iowa, the subsidy is pretty generous. It's 400%, up to 400% of the poverty level, which for a family of 4 is about $80,000. Now, the exchanges go into effect in 2014. So as you can imagine, there's a lot of work going on behind the scenes, and the Department of Public Health, the Department of Human Services, and the Insurance Division have been working very closely on trying to determine how we would create an exchange, which would have a 1-800 number and assistance to help you determine where best to find your coverage. We're in the very, I would say, preliminary stages right now of setting up that exchange. A lot has happened over the last couple years. We had a U.S. Supreme Court challenge where the law was upheld, and we have to meet certain deadlines in order for the state of Iowa to have its own exchange system. And so we're discussing how we're going to make that state-based exchange work. But right now, because I can't tell you where it will be located and how it will be located and who's going to run it, I want you to note that on our website at the Insurance Division, www.iid.iowa.gov, just Google us at Iowa Insurance Division, we have a template that's available that shows you everything that's going on in healthcare reform right now, what has been implemented, and what additional tools we need to get in place for the exchange to get up and running. So I guess I would much rather hear your questions, and I know Angie wants to share some information, but one thing I just want to pass along is if you are purchasing your own insurance now, you are not required to drop it to go into the exchange. If you don't have coverage or your employer doesn't, this is an opportunity of a way to get coverage. And if you qualify for a tax subsidy, you can get the tax subsidy through the exchange. Now, one other part that I wanted to mention that your organization has been very active in is the issue of navigators. Under the federal law, it allows for what we call assistants or navigators to help people purchase insurance. You don't pay them a fee, they get paid through the exchange. And a law was passed last year to set up the guidelines to create these navigators. We haven't really done anything with the law yet because we really still don't know how we're going to set up the exchange. But it's very possible that you could help get your insurance, not through an insurance agent, like we typically know somebody that you buy your auto or your homeowners, but you could go to a navigator, somebody who has been trained on health insurance and can help you navigate the system to get the right coverage. And you don't pay them a fee, it's paid through the navigator. Are any of you familiar with the Senior Health Insurance Information Program, SHIP? Okay, which is in our office, by the way. This is a similar type of program, like the SHIP volunteers. They don't get paid, but they're highly trained, and they will help you get through the system to get the right coverage. So as soon as we figure out how we're going to do that, we will let John Hale know. And by the way, you have a great advocate in John Hale up at the Capitol. He's done a wonderful job. We really appreciate that. So I know he's not here, so I could say some other things about John, but I won't. But in any event, there will be assistance throughout the state, a 1-800 number, and sort of counselors to help you determine if that's the best way for you to go when you get your health care coverage. So I'm going to let Angie talk for a little while, and then we can answer questions, but please feel free to call me at any time, and we will help you get answers to your questions.
I'm a mother of 4 boys, so usually I don't need microphones. I'm pretty good at talking loud and yelling, but it's a pretty big room, so we're not going to challenge me this early in the morning. So, good morning. First of all, the term exchange, it sounds so complicated and intimidating, doesn't it? Sounds like something you're going to go and buy stocks or something with. Well, that's one of the first things that we want to ask our consumers out there is there something else that makes it more tangible to you? So if you guys think of something, some of the states are asking about marketplace and other different titles. If you guys, people who will be accessing that exchange, if you can think of a name, a title that would be better, please let us know and we will take that into consideration. I think branding this complex system is something that we need to, as we talk about outreach and education, take on as one of our first priorities. Because generally when we say exchange, and we found that out in these focus groups I'm going to talk about, people's eyes just kind of cloud over. So please, again, we will look at consumers to help us brand this as we move forward. Okay, and I also wanted to point out a couple of the handouts we have for you. This is kind of a 101 cheat sheet of what an exchange is.